point. Are y'all able to hear me right now?
Yep, we can hear you and the screen
Awesome.
looks good.
Okay, perfect. So hey guys, my name is Annie. I'm a PGY4 with the UT Austin residency program. It's really nice to meet you guys virtually. I know it's not quite the same, and kudos to you guys as medical students like going through this process, because I honestly can't imagine how overwhelming it is. And so hopefully this information is somewhat helpful. I'm trying to go to the next slide if I can. Okay, perfect. So yeah, again, just a welcome from Austin, Texas, our beautiful state capital. If you're the kind of person that loves good music, good food, landscapes, cityscapes, I think this is just a wonderful place to live. And all of us as residents are just so grateful for the opportunity to live here. And I think after doing an intern year in Chicago, and that was actually like a suburb of Chicago, and paying that rent, I was super excited to come to Austin, and being able to afford a 2-bedroom was really nice. So I think this is helpful to kind of think about. I mean, we've all kind of gone through the process of hearing a lot of details about residency programs, and just taking a step back and thinking about, hey, why am I doing this? And, how does this really help my future self? And so just thinking about residency as a pathway to help clarify and achieve your personal and professional goals, and really practicing for your purpose-driven life, I think is really important. And so just choosing a residency program with yourself in mind and just your future self as well. I'm gonna minimize the box on the side because I'm realizing now that y'all probably can't see the entire slide. So I'll put it just right here. And yeah, through this process, eventually, essentially becoming a colleague, which is obviously really important. We want to be the best that we can for each other. So just allowing your past to inform your now, and allowing your now to sort of inform your future as well. I would love to take this opportunity for you guys to meet our program director, Dr. Garrison, who is just incredible. Not only does he serve as our program director, he wears many, many different hats. So in addition to that role, he also serves primarily as medical director of our inpatient rehab facility, Central Texas Rehab. Just a wonderful person, wonderful mentor, and someone who I think truly embodies kind of what it means to be a lifelong learner. So Dr. Garrison, I believe I saw your name, hopefully you're there, but if you would not mind just giving an overview, I guess, of the different faculty that are kind of listed on the slide set.
Yeah, so thank you, Annie.
Yeah,
my
sure.
name is Chris Garrison. I've been a program director for too many years that I can't count. I also serve as the chief of PM&R for Ascension Seton here in Austin, Texas. And recently, I am now medical director of all the sports performance program for Ascension Seton here. We cover the Bold Soccer Club, UT Sports Rec, a few other elements that, sports elements that we also cover. I'd like to highlight Dr. Bergfeld, our Associate Program Director, Dr. Wong, who I think is on the call. She heads up our consult service and the clerkships, does a great job, and who would be without, we wouldn't exist if it wasn't for our coordinator, Debbie LeBlanc. We all know that and appreciate our coordinators, and we have a great one. I think we got a couple more faculty I want to comment on, Annie.
Yes, I can move the slide set for you.
Yeah, Dr. Foreman is our pain management specialist, excellent. And Patrick Spicer, also our former innovation fellow, research fellow, and now doing a lot of work in the PEDS rehabilitation area and a lot of work in amputee. A recent addition is Dr. Staggs, who I trained quite a number of years ago, and now has returned to come on as a faculty member to direct our inpatient work, and has been doing a fabulous job. So we, as Annie pointed out, we try to help residents become colleagues, and that's the main goal of our residency training program. So Annie, thank you very much for this opportunity to chat about our faculty.
Of course, yeah, for sure. And just kind of moving forward, I'd like for you guys to just get a sense of, our current resident class. And so I'm really just so grateful to be able to serve as chief for our group with my co-resident Christina Paul. And so we are an advanced program. So your Austin training will begin your second year, your PGY 2 year essentially. We have 6 total residents, 2 per year. So essentially, I mean, I guess the biggest takeaway from this slide is I think a lot of folks tend to think like, oh, Texas schools tend to recruit like Texas medical students and things like that. So actually, interestingly, the majority of our current resident class is from outside of Texas. And so just to introduce you guys to our PGY2s, Gabby is actually from Seattle, went to medical school in California. We have Nam as well, who's from Dallas, went to Texas A&M. We have Eddie and Lindsay as part of our PGY3 cohort. And so Eddie went to school in Oregon and is originally from Orange County, California. And Lindsay is both from Ohio and actually went to the Ohio State for medical school as well. And just going over, I guess, myself. So I'm from Houston. I went to medical school at Vanderbilt and then was fortunate enough to match here at UT Austin. And my co-resident, Christina Paul, is originally from Maryland, went to Georgetown for medical school and is now in Austin. So yeah, just for incoming class, our 2 new residents starting in July 2021. So we have Ali Ahmed, who is from El Paso, Texas, and went to medical school at Texas Tech. And we also have Anthony Reviso, who is from Chicago and went to Midwestern University in Chicago as well. So our next slide is basically just, this looks overwhelming. It's a lot of like text in an Excel spreadsheet, but basically, I mean, I'll break it down for the next slide, but essentially it's like taking the collective schedule and how does this really help inform your life goals, and just kind of thinking more about that as we go through each of the rotations is kind of helpful. So if we were to take one residence schedule out of the prior slide, it would kind of look like this. So your PGY2 year is essentially 6 blocks, and each block is 2 months. And so this person, which I think it actually might even be my schedule. So you start on Central Texas Neuro, which is like your inpatient rehabilitation months. And so you'll have that for 2 months. If you are a PGY2 or 3, you will be paired with an inpatient senior who is a PGY 3 or 4. So essentially you're working as a single academic service for 4 months out of the total year. But again, that's split into 2 months and 2 months. It's very nice because rather than kind of front loading everything with, 1 year of inpatient, which can be quite physically and mentally exhausting. So from a wellness standpoint, it's super nice. The other advantage is honestly, you learn so much about just the various aspects of PM&R from your outpatient rotations, and then bringing that back to your inpatient rotation. I mean, you'll be able to like see what a difference that makes essentially, and really supplements your learning in that way. So I really think that's a strong point for our program as well. And then we'll go over kind of all the other rotations that are listed basically. So yeah, inpatient rehab, it takes place at Central Texas Rehabilitation Hospital. It is a 50-bed hospital. Again, it's 4 months out of the year in 2-month blocks. The single academic service is with Dr. Staggs currently, and it's a pairing of a senior and a junior resident as well. You see a ton of stuff, and honestly, that goes for pretty much every single rotation that we're on in the hospitals that are kind of within the Seton facility set, as you would say, include, it's just kind of a catch-all for not only Austin, but it's also a catch-all for the Central Texas area as a whole. So really just a ton of stuff that goes there ends up coming to us, and it's really interesting from a learning standpoint to be able to experience some of that. In general, I would say the census tends to lie around about 20 or so, tends to go up to 25, but of course that'll be in flux, and so it's to be managing it. So definitely manageable, but still enriching enough that you are seeing a ton of different things. You do have the opportunity to lead team conference. That is a little different from some other institutions. You are essentially the attending as a 4th year, and then as a 3rd and 2nd, of course, it's kind of graduated, but you attempt to do your best leading team conference with supplements from your team members. And we also do participate in like bowel bladder rounds as well. And one thing that I think is interesting with their program is you really get a sense of longitudinal care, and that'll make more sense as I go over some of the next rotations, but you get to see kind of some folks on consults, and you'll see them at Central Texas and then follow them up in Continuity Clinic. And so it's just incredible to see their response to, therapies and treatment modalities and all those kinds of things. In addition to the things that I mentioned, we also have the opportunity for professor rounds with Dr. Garrison and go over a variety of different things with him and learn from his expertise as well. Next, we have PM&R Consults. So this primarily takes place at Del Seton Medical Center, which is a level 1 trauma center. Again, catch all, you see everything. You have 1 block your PGY 2 year and 1 block your PGY 4 year. When there are interesting consults, we will also go to Seton Medical Center in Seton Williamson, or if it becomes like it's something like, oh, let's do an electrodiagnostic procedure over there, we certainly do cover those hospitals as well. We work a lot with Dr. Wong, who is, I believe, the physical examination guru, and you get a ton of thorough one-on-one teaching and mentorship. And for me, I think this was the greatest period of growth, was really during the PM&R Consults rotation. So yeah, we also have like Sicky rounds, therapy huddle, all those kinds of things, and just that longitudinal opportunity to continue to monitor folks that we did see on consults a little bit later in their path to recovery and just the rehab process. Everyone's favorite topic, I guess, inpatient call. So we do not have a requirement for overnight or 24-hour in-house call. And so that's really great, but why is it that way? And so we'll talk a little bit more about that on the next slide. But the general gist is essentially you only take call when you're on quote unquote inpatient months. And so that includes Central Texas Rehab, and that also includes your consults months as well. So for Central Texas and consults, actually, you will cover all pages from 7 a.m. to 7 p.m. For Central Texas, you have 1 weekend per month for 2 weekends total for your block. And then you have 1 week of like home call, essentially, which is 2 weeks total. And for consults, you just have the 1 weekend per month call at Central Texas, which is 2 weekends total. You do not have the 1 week home call requirement during that period of time. So I guess, like, why is it the way that it is? So really your call structure should relate and translate into function. And so we all want to sort of actually learn during this time period. And it's super important because in the real world, if you were to go into something like inpatient rehabilitation, it's very unlikely and quite rare that you would be required to sort of be staying in-house in the hospital. And so learning to perform those in-depth, accurate patient assessments remotely is definitely a skill set that has taken me some time to develop, and just super important for being, practical and developing actual real-world experience while also working smarter as well. And at the same time, experiencing like a heavy census workload, allowing you some time to breathe as well is very important. And just the concept, I guess, of like developing an internal locus of control is also just something helpful as well. So really call learning is what you make of it. And, the difference between an internal locus of control or demonstrating that versus an external locus of control is really, taking ownership and saying, you make things happen. And so it really is what you make of it, just being self-driven, all those kinds of things. Continuity Clinic is one of our favorite things and a very unique feature of this program. So this happens with Dr. Bergfeld. It's very much resident-led. So this is like your clinic, it's your patients taking ownership. It tends to happen, well, it is weekly actually. For one half day, you either will have like an AM or a PM clinic. You also obviously get hands-on physical exam guidance and imaging review opportunities and case discussions and things like that. And we just get referrals from literally everywhere, I feel like. So you just see a ton of pathology, and it's just such a good experience. And this is also a scenario where you do see that longitudinal learning, and we actually do get to follow up with post-discharge Central Texas sort of follow-ups too. So again, a great opportunity to sort of see that as well. And of course, since we do have to do this in the real world, you obviously are responsible for managing your outpatient inbox, following up on messages, ordering imaging labs, and all those kinds of things too. Your Selective, so this is 4 months total, which are 2 blocks each. So you want to tailor and really design your Selective, and that opportunity is certainly there if you take ownership of it. So I, for instance, I guess did a women's health rehab and spinal cord injury rotation at TIER and with Texas Children's Texas Women's Pavilion, which was just a very insightful educational experience. My co-resident Christina is very interested in cancer rehabilitation, is actually doing interviews right now. And so she had done rotations at Memorial Sloan Kettering, Johns Hopkins, MD Anderson, actually currently even. We've had folks rotate at Harvard, Shirley Ryan for sports MSK, pediatric pain at Cincinnati Children's, just pain management rotations at UTSA, MD Anderson. So really, I mean, if there's something that you're interested in specifically, the world is your oyster, essentially. There's also the opportunity additionally to do research for that 2-month time period, and potentially would be open if you did have a design for a comprehensive project with some concrete goals and things like that, to extend it beyond that time point for your next selective as well. Pediatrics is just a great rotation as well. You work with Dr. Spicer, just very complex, patient subset, and our inpatient unit is comprised of 8 beds. And in addition to that, you have coverage for that, and then the consult service as well. And you also cover the multidisciplinary clinics, including concussion, spina bifida, spasticity, aerodigestive, hand clinic, where you'll see a lot of brachial plexus injuries. In addition to that, you also cover the PEDS rehab clinic, and you get your electrodiagnostics, Botox, baclofen pump training during this time as well. Some of your
You guys
other
have just under 5 minutes.
Okay, thank you. These are some of the other rotations that are listed: outpatient MSK, pain, rehab, and so I will leave that for you guys to review at a later point in time if that's okay. But essentially, it just includes all the things that you would want included during those rotations. I would love to highlight some of our competitive fellowships just to kind of illustrate where our graduates end up going, and a lot of them match into, this is just a list of the most recent years, and so kind of covers, I guess, more recently, Dr. Reddy matched into neuromuscular fellowship at UC Davis. We had Allie graduate and go to Northwestern, where she was a sports medicine fellow with Shirley Ryan. But yeah, this just demonstrates that our graduates go to top-notch programs, competitive programs, and end up with top-notch positions at within faculty as well in different departments too. So that's really cool. So yeah, I think our program demonstrates the quote on the left, which dream big, work hard, stay focused, surround yourself with good people. Our faculty are very highly invested in resident education and training our future colleagues. There are clear opportunities for professional mentorship and really competitive fellowship matches and job opportunities. Again, we talked about, the great opportunities available with selectives, research leadership. Really anything you want can be constructed here with our group, and your resident group really essentially becomes your extended family. And of course, UT Austin is in Austin, obviously. And so there are definitely collaborative efforts available throughout the UT system too. And it's a very hands-on educational program too. Didactics, of course, we have this as well. Wednesday morning at 7 a.m. to noon, just cover a whole host of topics, and I'll leave that there on the left side for you guys to review at a later point in time. We have Journal Club, which is the last Thursday of the month, where we discuss about 3 articles or so, both current and classic, and then the faculty sort of helps us take away, what are the practical points, what are you going to remember, and how is this actually important for you? We do have a virtual meet and greet and sort of happy hour on Tuesday, September 8th from 7 to 8 p.m. Central Time for residents and medical students. And so the details for this will be available on the AAP schedule later this week. And if you have any questions, please feel free to contact Debbie LeBlanc, who is our wonderful program coordinator. If you have questions, our contacts are listed on this slide over here, as well as our website, so please feel free. We all love each other deeply. You can see on the right side, my co-resident Christine is actually helping babysit and take care of my lovely daughter, Eva, who is now 1.5 years old. And so, we just have a good time together. And when it's a small program, we're all super close-knit. And it's just a lot of fun to hang out and just great learning all together. So yeah, thank you. I guess, Dr. Wong, I don't know if you're there, but if anyone else is part of the UT Austin program would like to say hi, now's a good opportunity, or happy to take questions too. I'm gonna stop sharing my screen so I can potentially see the chat too.
We have someone asking
Yes,
to share the contacts one more time.
Yes, I will go back. Give me just a second. Let me see if I can get to the share screen.
Here, one of the faculty who does saying hi. Thank you so much, Annie, and thank you for everyone's participation in this and in your interest in our program.
All right, so I do have the contact slide up to just up on the screen right now if you all are able to actually see it. And if there are more questions, if someone doesn't mind.
I see some in the chat.
Oh, there it is. I see the chat now. Okay.
So what do you look for in a program applicant? I think we're very big on the, internal locus of control. I think having a good vision of what you really want and being very self-driven, I think would really be something that we're looking for in an applicant, and something that will, give you a lot of success while you're here. We do have a lot of flexibility with selectives, and it's been an incredible opportunity. And I think that is something that's very important. We're a small group too, so we have a little family here, and I think we're just looking for good people to join our little PM&R family to one day have as colleagues too. So,
I could comment why both Annie and Christina talk about the internal locus of control. It's really about self-starting and the ability to play well in the sandbox with other folks. And that is reflected deeper into the curriculum where selectives are at a high level. You get to choose where you want to go, how you want to design a lot of the curriculum, a lot of flexibility in that. And it's reflected. Those that are successful in the residency program are the ones that end up embodying that internal locus of control and being able to be self-starter.
Awesome, guys. I'm going to have to call time.